Aibovan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando and this is your weekly dose of wellness here on Healthline. Today we are going to be talking about a very common condition. I'm sure you would have come across so many people who are suffering from this situation. This is none other than the condition of varicose veins. To talk about this topic in depth, we have invited a very special person to our studios here today. He is none other than Dr. Daminda Rajamantri. He is a consultant vascular surgeon. A very good evening to you, sir, and thank you for joining us here on Healthline.
Thank you, Dilshan. Thank you very much for inviting me today to be on Healthline, and good day to you viewers.
So, it's a very common condition, sir, but before we talk about varicose veins itself, I think it will be important for our viewers to understand what these veins are, how it is, the structure of it. If you can just give us a bit of elaboration on that.
Yes, certainly. So, before we get on to veins per se, people sometimes confuse all blood vessels together. So, there are two main categories of blood vessels in the body. One is called the artery, other one is called the vein. Now, the arteries are meant to be under pressure, they are high pressure vessels, and the veins are low pressure vessels. So, the varicose veins usually arises from the venous system or the veins. The veins are the vessels which pump the blood back into the heart, and it happens with just a kind of a low pressure system. Now, the varicose veins is a result of the pressure in these veins going up. So, it has nothing to do with hypertension, but it's just the veins which are malfunctioning, which will end up with a higher pressure inside, causing them to bulge and elongate. So, when they elongate, they become very tortuous. So, that's varicose veins.
So, now who are more at risk to develop these? What are the risk factors involved in this varicose veins?
Yeah, most of them are actually due to hereditary factors. About 75% of our population are the varicose veins happen because their family has a predisposition to varicose veins. Then of course, there is a 25% which happens just for no known reason. And the other question you asked, the females are more prone to have varicose veins, partly because of the pregnancy and the hormonal changes. So, lots of women develop varicose veins after the pregnancy.
And also, sir, now we know that certain people think that standing for a long period of time or gaining a lot of weight, being obese, do those have any a predisposition towards causing varicose veins?
Yeah, well, I wouldn't say it causes varicose veins, but in the people who have the tendency to develop varicose veins, they probably bring it on faster or earlier in life. So, and the progression also gets hastened if these factors which you mentioned are there. So, people who stand for a long time and do, like, teachers, barbers, cooks, they do develop the varicose veins pretty fast.
So, if a person's family or if their mother or father maybe has had varicose veins and they are also engaged in something that makes them stand for a long period of time, is there a particular precaution they should take in their day-to-day life?
Well, we really do not advise on such measures because most of the measures that are there will be hindering their life and their job. So, we can't, there are people who, there are even doctors who might advise them to change job. Yeah. That's not a kind of thing we generally advocate because the solution is pretty simple. So, if you get varicose veins, we fix it.
Right. So, now when I introduced the topic, I said it's quite common. But how is the situation really? How common is it in Sri Lanka and how do we compare with the Western world?
Yeah, so in Sri Lanka we do not have many population based statistics. The only study which I know which studied a large number of people, but for convenience it was the visitors who came to National Hospital when we were training long ago. We did this, anyone who volunteered to come and take a check to see whether they had varicose veins, and they were volunteers basically. And about 22% of the visitors to the National Hospital had some type of varicose vein or the other. So we do not know really what the percentage is in the population. And the incidence matches pretty well with other countries. But of course, most of this 22% are not people who need treatment. So there are different types of varicose veins, and the minor varicose veins do not actually need treatment. They are mainly considered to be a cosmetic problem. You know, what's known as the thread veins, spider veins, and reticular veins.
So now, when we consider most of the diseases now with our current lifestyle and being sedentary and all these dietary changes and all, most of our diseases are increasing in incidence. But when it comes to varicose veins, how is the situation? Is it increasing or is it still remaining static?
Well, I don't think it's really making a difference to the, you know, of course people work harder and they stand for longer.
Yeah.
So more people develop varicose veins now, I would say earlier in life. But again, there is no statistical data to support that. It's just an observation.
Right. So when we talk about varicose veins, now what most of our lay community would have seen are the engorged, elongated veins in their leg, which are a bit unsightly. But when you really talk about the symptoms of varicose veins, if you can just elaborate, I think that would be beneficial, because when we see those elongated tortuous veins, I think that's more towards the progressed state of disease.
Yes. Yeah. So the first thing people notice is bulging veins. Now, a vast majority of these patients are asymptomatic. In other words, they do not have any symptoms. And then of course, the symptoms come on gradually. It's a bit of pain when they stand for long, and people tend to ignore that. So because of its gradual increase, people do not really take any notice or take any action because they get used to it. So they make little adjustments to their lifestyle and carry on with it until the late stage. So the late stage is where you get itching, you get cramps, and then the skin becomes blackened. Tiny vessels can rupture inside the skin and then give a lot of discoloration. And the late stage, very late stage, will be an ulcer which refuses to heal, and even after healing it tends to come back. So that is the stage where it really impedes a person's quality of life.
Yes, because most of our people might think, okay, I might have engorged veins, but does it really matter? But like Dr. Daminda Rajamantri said, if you neglect it, if you let it go on without proper intervention, you may face some undesired complications like what Dr. Rajamantri just described. So now, when a patient presents to you, sir, and they complain of these symptoms, they might have some engorged veins, what would be your approach in diagnosing? What questions would you be asking, and what kind of investigations would you employ in diagnosing what this condition is?
So, as I mentioned, there are a vast majority of patients who just come because there are visible veins, and very often it's not a problem to them, but there are people around them who will tell them, go get it fixed. You know, I know a person who ruptured and they bled during sleep. So it really, people panic and they do come because of that. So the diagnosis is pretty straightforward. It's a layman's diagnosis, but confirmation comes by way of an ultrasound scan, which generally takes about 5 to 10 minutes. It's a very simple procedure where we actually map out the malfunctioning veins. We measure the diameters and then decide what form of treatment is best. Now, treatment options have changed drastically over the last 2 decades, I would say, and from surgery, which had developed a very bad reputation by the time this new technology came in, which is known as laser ablation. Now, the laser basically avoids an operation altogether. It avoids major anesthesia, like you don't need a general anesthetic or a spinal anesthetic. And the advantage of that is you end up with no cuts, no stitches, just punctures with needles. And because it's done under local anesthetic, you are able to walk soon after the procedure and walk back home. So it's revolutionized the treatment of varicose veins and also the fear of having an operation for this particular condition. So we tend to fix more than we used to, because people do come in now with even slighter, less symptoms to have relief.
And this is done as a day procedure, I presume. They don't need to get admitted in
That's
hospital.
correct, yes. It's also known as, some people call it an office procedure. So, but in Sri Lanka we still do it in theatre, so it's called a day procedure because we need a clean environment to make sure all these punctures are done in a very sterile manner and in a safe manner.
So that is very positive news for all our viewers. Technology has really advanced, especially in medicine and surgery. So if you do have varicose veins, the procedure, the laser ablation of these varicose veins, which is the recommended procedure for your varicose veins, is done as a day procedure. You don't need to get admitted. Done under local anesthesia, there will be no cuts, and of course you will be able to go home the same day itself. So that is one very positive message that we want to convey to our viewers. Now sir, talking about, you said the ones that ignore their symptoms and the complications of it.
Yes.
So when they do develop complications, how would we manage that?
Yeah, well, the complications come in the form of what's known as phlebitis, that is infection of these veins, and then you can have itching, ulceration. Now, the earlier approach for the ulcer, which is the very late stage, was to heal the ulcer first using all kinds of dressings and compression strappings and things like that, and then do the operation. So the reason for that was an operation can get infected when there is a focus of infection in the same leg. Now with the laser, that problem has been taken away. Now we are able to fix the cause of the ulcer and hasten the healing process. So we do varicose vein laser procedures while the ulcer is active. So that is a big change which has happened over the years. And then of course, because you don't need any form of anesthesia, or you need local anesthetic, but you don't need a general anesthetic or a spinal anesthetic, which has made the treatment available even to the very much older people, the people with heart conditions who are on blood thinners. So there is a whole group of other patients who don't have to suffer anymore with varicose veins and ulcers, and they can be fixed. So that's also very good news, very positive news with new technology.
So after getting the laser ablation done for their varicose veins, you said it's done as a day procedure.
Yes.
They can go home the same day, they can walk. But are there any precautions that they should take, anything that they should abstain from, or anything that they should be doing?
Not really. So the procedure has been made so simple. It's basically just walk in, get it done and go. I have patients sometimes coming from far away parts of Sri Lanka who do not want to come again, and they just have the consultation, get the job done and go back on the same day. So that's how simplified the whole thing has become. And there is nothing really to get ready, or after procedure it's back to normal life. So the issue is this is not a life-threatening condition. That's the very reason people are not forced to do it, and they postpone it. And it comes to a point where things become very difficult, and then they are forced to do it, but still we are able to do it now.
So, that is an important message that I want to reiterate once again. Even though it may not impede your lifestyle very much at the initial stages, if you do ignore this condition, it might turn out to be a condition that can be managed, but might be difficult for you. So, now sir, if you get varicose veins in one leg, are you more prone to develop it in the other leg as well?
That's correct, yes. Yes. So, actually about half 50% of the people who come with varicose veins have some degree of varicose veins on the other leg, which can progress. So, it is not a case of fixing one leg and this disease has now gone to the other. So, that is a kind of a wrong belief people have. What really happens is most of them, a majority of them do have it on both sides, but one side precedes the other and symptoms come on one side first. The issue is we are not used to fixing operating on a leg which did not have any symptoms. But now, because the procedure is so simple, it makes sense to fix the other leg sometimes even before the symptoms happen, if you are doing one. So, if the other one is about to have symptoms, we tend to fix it sometimes.
And when we talk about varicose veins, we have seen patients wearing these crepe bandages and various dressings on their legs. Is that actually indicated, and if so, what kind of precautions should they take? Because most of these bandages are administered by themselves at home.
Yes.
And sometimes they put it on too tight, sometimes they just put it on too loose. If you can just tell our viewers, when are these bandages required and what kind of precautions should they take when applying these bandages?
Yeah, so as I mentioned before, there used to be a category of patients who were not suitable for surgery because they were on various medications or whether they had heart failure or something like that, and oils who were too old, considered too old for surgery. For that category of people, there used to be stockings. The stockings are still there, yeah. But we used to use stockings as a temporary measure to relieve their symptoms. They do relieve the symptoms. So, people tend to use that as a stopgap measure to postpone the procedure, and which is good because it can slow down the progress of the varicose veins as well as relieve your symptoms. And since it is not a life-threatening condition, you can actually wait until it comes to a point where even the stockings do not work, and then since the operation is or the laser procedure is quite a simple one, putting it off is not a big issue. The only thing I would mention is if it is postponed for too long, then the veins become bigger, and then the amount of laser we have to use to burn this vein from inside is higher, and that can cause a bit more pain. So, in the early stage the results are better as in most conditions, and in the late stage the pain levels get little. So, this is not a completely pain-free procedure as people might like to say. After the procedure you need some simple analgesics like paracetamol to get about your normal daily routine. That can go on for a week, sometimes 2 weeks, but it's nothing unmanageable. But if you postpone it for too long, then you might have a situation where the pain might be severe enough for you to stay away from work for a week. Generally it is back to work. I have had people back to work on the same day, especially surgeons.
So, if you are leading a busy lifestyle and if you don't want to spend too much time in a hospital, this is very good news for you. It's always good to be followed up by a properly qualified medical practitioner, get your symptoms checked out, and if it is indeed varicose veins like Dr. Rajamantri mentioned, you can get it done as a day procedure. Now, sir, when you talk about this laser ablation, it's basically in layman's term we burn this affected vein via laser. Now people might wonder, because we said earlier these veins are the vessels that take the blood towards the heart. So when you do burn it, will there be any problem? It might occur to our patients. Will it cause any problems in taking the blood back towards the heart?
Yeah, so I think we missed that part in the anatomy initially. So varicose veins are generally, we talk about varicose veins in the legs, not in any other part of the body. In the legs, there are two systems of veins. One is called the deep venous system, which is carrying the blood within the muscles deep inside, and then you have the superficial venous system, which is just under the skin, and that drains into the deep system, and that's how the blood flow happens, to put it in very simple terms. Now 75% of the blood flow of the leg happens through the deep system. The superficial system takes the rest of it, but there are so many veins under the skin, there is not one. Now even for heart bypass procedures, there is this vein which is a long saphenous vein, which is taken for the heart bypass, because that is a vein which can be kind of spared, and taking it away does not make any difference to the venous drainage of the limb. So the same thing happens in venous ablation or laser ablation. What we do is we block off the vein with the laser, and the other veins readily take over. The issue is the varicose vein is anyway not functioning. It's not doing any useful function. It's actually undoing the good work the other veins are doing. So knocking it off is actually beneficial to the leg and the venous return.
Right. So that may have answered any of your doubts that you may have had in your mind. Now with the time constraints we have, sir, we cannot go more in depth in this topic, but before we wind up, what would be your take home message to our viewers, because this is a very common condition, you can see it very commonly in our day to day practice. So I think what would be your take home message that you may give our viewers?
Yeah, so the take home message would be, I would say varicose veins is not a life threatening condition, but it does affect your quality of life, and that the problem is it goes on for years, and so many years of your good life is taken away due to the pain in the legs and sometimes ulcers. So the solution is pretty straightforward now, and it doesn't involve any surgery, and I would say take treatment, go to a vascular surgeon who is trained in doing the laser in the correct manner. A lot depends on the expertise of the operator to reduce the pain levels as well as reducing what's called the recurrence rate. So recurrence rates are well below 5%, and that also happens after 10 years. So get treatment through a qualified vascular surgeon.
Yes, indeed. Like we always reiterate, if you do have any symptoms and signs, it's always good to go to the proper specialist in that subject so that you can get the timely intervention that you need. And like they say, it's not about the number of years in your life, but the life in your years, the quality of life. So like Dr. Rajamantri said, even though it may not be a life threatening condition, it may severely impede your quality of life if you don't get timely intervention. So I think we had a good conversation. So I think our viewers would have greatly benefited, especially by the fact that their knowledge about this laser ablation, which is a day procedure now, they won't have to undergo any anesthesia. So I think that would encourage our viewers who are facing these symptoms to come to a vascular surgeon, get their symptoms checked out, and if they do have this condition, to get it corrected by this laser ablation. So I thank you very much, sir, for coming in and educating our public and gracing the Healthline studios. Thank you very much.
And thank you very much for having me today. Thank you very much.
So with that, we wind up from this edition of Healthline. Until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.